Assalamu alaikum, everyone. My name is Ebraheem Hoda. I'm a second year medical student, and today, inshallah, I'll be giving you guys the MOL PAL on the reactive oxygen species. I know when Dr. Jalal teaches this lecture, it seems all over the place, but inshallah, as we go along today, we'll cover everything, and it will be a good PAL, inshallah. You guys will benefit from this. Okay, so let's get started. Okay, so starting off, we'll be taking the core definitions. Let's start off with free radicals and redox reactions, okay? A free radical is basically a molecule that has one or more unpaired electrons, okay? Because of these unpaired electrons, these free radicals will lack stability and will be highly reactive, okay? Since they're missing electrons, these free radicals will try to steal electrons from other molecules in your body. They will take electrons from your proteins, your lipids, your carbohydrates, and even your DNA, okay? When the free radical steals an electron from one of these structures, it will cause damage to this structure, okay? This is why free radicals are considered harmful. They will disrupt your normal molecules and make them more unstable. Over here, you can see you have a free radical over here. It has an unpaired electron, and there's a stable molecule over here. It has a full pair of it has a full pair of electrons. So it will take an electron from this stable molecule, causing damage to it, okay? Moving on, redox reactions, okay? Re for reduction and ox for oxidation, redox reactions in its name itself. So these are reactions where reduction and oxidation will take place simultaneously. Oxidation is the loss of electrons by an atom, molecule, or ion, and this will make the molecule less stable, typically, while reduction is the gain of electrons, where this will basically typically make your molecule more stable, okay? Let's move on. So, as we said earlier, the free radicals, they're very highly reactive because they contain unpaired electrons, all right? Another important characteristic of these free radicals is that they have a very short half-life. What this basically means is that a free radical, once it is generated, it will act immediately, okay? It does not remain in your body for a very long amount of time, but during this amount of time, it causes a lot of damage. Free radicals, they will also cause a chain reaction. So when a free radical is generated, okay, it will steal an electron from a stable molecule. And that molecule will now become a new free radical, okay? This new free radical will then go and steal an electron from another molecule, okay? Producing another free radical. And the cycle keeps going, causing a very vicious cycle, okay? So it's not one single injury that happens. These free radicals will cause a very vicious cycle of continuous damage. Now, because of this just chain reactions, the free radicals will cause damage to your biomolecules, such as your cells and tissues, as we know. And yeah, okay. So we classify our free radicals into two major groups, okay? We have our reactive oxygen species and our reactive nitrogen species. Our reactive oxygen species, these are derived from oxygen, from the name, and reactive nitrogen species are derived from our nitrogen, from the name it's again, okay? Both of these molecules, they will cause cellular damage and they will cause oxidative stress, as we will see in a bit. Let's move on. Okay. Now, we'll be talking about and learning about the three main categories of species that will cause oxidative stress. Let's start off with radicals, okay? These are molecules that have unpaired electrons that will make them very highly reactive. The key radicals that you need to know from these three is superoxide and hydroxyl radical, okay? These are the two most important reactive oxygen species. Next, we have our non-radicals, okay? These are molecules that do not have unpaired electrons, but they will still participate in redox reactions, okay? And they'll participate in redox reactions and they will cause cellular damage. Honestly, you need to know, like, you should know all of them, but if you had to keep two in mind, I would tell you guys to keep in mind hydrogen peroxide and peroxynitrite, okay? These non-radicals, they're not technically radicals per se, but they will basically generate radicals and contribute to your oxidative stress in your body, okay? Next, lastly, we have our nitrogen radicals, okay? These are the reactive oxygen species, reactive species that are produced from nitrogen. The main one from these two that you have to know is nitric oxide, okay? Nitric oxide specifically is very important because it acts as a signaling molecule and is also a source of oxidative injury when it's combined with superoxide, something that we will take right now. So, under normal conditions, the body will use nitric oxide and superoxide to kill bacteria, okay? This is especially seen in your macrophages. So when there's a large amount of pathogens or large amount of bacteria in your body, there'll be a large generation of nitric oxide and superoxide, okay? This will cause the nitric oxide and superoxide to come into close contact with each other. When this happens, they will form something called peroxynitrite, okay? Peroxynitrite is very toxic, okay? Instead of killing the bacteria, it will start to damage your own cells, okay? So the key point here is nitric oxide, it will react with superoxide and it will form peroxynitrite. Peroxynitrite, on the other hand, is very damaging and will cause lipid peroxidation, protein modification, and random DNA damage. Okay, this is basically the reason why inflammation in your body will cause more. Can cause harm to your own body itself. Okay, let's move on. Now we'll be talking about the half-life. From all of these, I want you guys to keep in mind the main ones is the fastest one and the slowest one. The fastest half-life, you have hydroxyl radical with a half-life of a few nanoseconds, and the slowest half-life is of hydrogen peroxide with a half-life of a few minutes. Okay. Other than this, anything that we took in detail, so nitric oxide, just remember it has a half-life of a few seconds, peroxynitrite, half-life of milliseconds, and you have superoxide anion, half-life of microseconds, okay? But the main two that they're most likely to test you guys on is the fastest one and the slowest one, hydroxyl and hydrogen peroxide, okay? Now, this is your basically the bottom line slide where everything that we just mentioned and the high yield ones that you want to keep in mind. So nitric oxide for nitrogen radicals. For the radicals, you want to keep in mind superoxide and hydroxyl. And non-radicals, you want to keep in mind hydrogen peroxide and peroxynitrite. Reactive species, we said the fastest one. Is your hydroxyl radical with a half-life of a few nanoseconds. The slowest one is your hydrogen peroxide with a half-life of a few minutes. Nitric oxide has a half-life of a few seconds. Peroxynitrite, half-life of a few milliseconds, and superoxide anion of a half-life of a few microseconds. Okay. So, any questions so far? No questions? Okay. 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 That's good. Let's move on. I have a question for you guys. So, a substance has a moderate half-life, acts as a vasodilator, and when combined with another free radical, will form a very cytotoxic molecule. What species is this describing? Send it into. Okay. Okay. All right. Good job. So, as you guys all said, the answer is D. So moderate half-life, we just took that. Nitric oxide has a moderate half-life of a few seconds. It acts as a vasodilator, and you guys probably took this in CVP. And when it's combined with superoxide, it will form the very highly cytotoxic molecule peroxynitrite. Okay, let's move on. So now we'll be talking about the generation of hydroxyl radicals. All right, so hydroxyl radicals are the most reactive and the most dangerous free radicals in your body. Okay, they're produced mainly through reactions that involve iron. Okay, this especially happens when there is hydrogen peroxide present. So in your body, you have your white blood cells. These white blood cells, they will produce superoxide. Okay, these superoxides can go and react with your ferric iron, which is your Fe3 plus, and this will lead the ferric iron to be reduced into ferrous iron. Okay. Now, this ferrous iron will go and it will react with hydrogen peroxide, and this will produce a very highly reactive species, your hydroxyl radical. Okay, I want you guys to keep in mind that the hydroxyl radical is the most reactive and the most dangerous free radical. Okay, so the overall reaction of the reduction of iron into ferrous form and the combination of that reaction with Fenton reaction will lead to the overall reaction forming, which is your Haber-Weiss reaction, however you pronounce that. That's your net reaction. Okay. So this reaction is basically the overall reaction that will show how the superoxide and the hydrogen peroxide will work together to form your hydroxyl reaction, radicals, okay? Keep in mind, your superoxide by itself, it is not strong enough to interact with hydrogen peroxide, so it has to cycle through your Fenton reaction and your iron to form the hydroxyl radical, okay? Now, another thing you guys have to remember is that many of us, like even in the Zoom, we probably have someone who is iron deficient. Okay, so iron deficients are very iron deficient. Okay, so iron supplements are very commonly prescribed. Okay, so people who have iron deficiency, anemia, pregnant women, children, all of these people can be prescribed iron supplementation. The important thing that you want to keep in mind is that the form in which the iron is administered, because the free unbound iron in your body, it will cause these reactions. Okay, it will participate in these reactions and can cause generation of reactive oxygen species. So excess free iron will go and react with hydrogen peroxide via the Fenton reaction, and this will produce your hydroxyl radical, which is your extremely reactive and potentially damaging radical. Okay, so that's it for hydroxyl radical generation. Now let's move on. Now we'll be moving on to the pathway and the clearance of reactive oxygen species. So we'll be starting off with the generation of superoxide. Okay. Now, your superoxide, it is generated through three main pathways, okay? You have your physiological pathway, you have your xanthine oxidase pathway, and you have your electron transport chain. Let's start off with our physiological pathway. So this pathway, it takes place in our white blood cells. So our white blood cells, again, they produce superoxide to kill your bacteria and invaders. The enzyme used to do this is your NADPH oxidase, okay? This enzyme, NADPH oxidase. This enzyme requires NADPH as a cofactor, okay? This NADPH, where does it come from? It comes from your pentose phosphate pathway, okay? That's all for your physiological pathway. Next, we have our xanthine oxidase pathway. So this enzyme, xanthine oxidase, it participates in your purine degradation. So your adenine and guanine, they'll be degraded by this enzyme, xanthine oxidase, and this will lead to the formation of two things, okay? It will lead to the formation of uric acid as well as superoxide as a byproduct, okay? And this enzyme is found in your systole. Lastly, we have our electron transport chain. So our electron transport chain in our mitochondria, it has many complexes, okay? The main complexes that you guys want to remember is your complex 1 and complex 3. And from these two, the important one is your complex 1, okay? In this mechanism, the superoxide is generated when the electrons are leaked from your electron transport chain, okay? These electrons will go and react with your oxygen, and this will cause the generation of superoxide, okay? All clear so far? Any questions? Clear. Okay, let's go. We'll continue. Now we'll be talking about how this superoxide will be converted into hydrogen peroxide, okay? Now, superoxide by itself is very reactive. So we want to stop it from causing a lot of damage. So what the body does now is that it will convert it into a less reactive species, which is your hydrogen peroxide, okay? This reaction specifically is catalyzed by the enzyme superoxide dismutase. This superoxide dismutase is found in both your systole and your mitochondria and will convert the superoxide into hydrogen peroxide, okay? Hydrogen peroxide by itself is still reactive, but it will be less damaging than the superoxide, okay? That's a summary of the step. Let's move on. Now, neutralization. So now that we have hydrogen peroxide, we have to further neutralize it into water to prevent any more damage, okay? How this happens is via two main enzymes, okay? You have catalase and you have glutathione peroxidase, okay? Let's start with catalase. So catalase, it will go and convert your hydrogen peroxide into water and oxygen. So catalase converts it into both water as well as oxygen. But the thing with catalase is that it is not very efficient at doing so, okay? So it has a very limited amount of it has a very limited capacity to do so, and so it's not very efficient. So in that case, we have the other enzyme, which is our glutathione peroxidase, okay? This glutathione peroxidase is the primary enzyme that is used to detoxify H2O2 into water, okay? During this process, we have reduced glutathione, and this reduced glutathione will be oxidized into our oxidized glutathione, okay? So we want to regenerate this reduced glutathione. Why? Because the glutathione peroxidase will use this reduced form of glutathione to do its function, okay? How this is regenerated is by the other enzyme, which is glutathione reductase, okay? Now, glutathione reductase will use again NADPH, and this NADPH comes again from your pentose phosphate pathway and is used as a cofactor, okay? So that's basically it for this step. Do you guys want me to go over it again? Because it might be a little confusing. Okay. So again, let's go over it again. So again, we want to neutralize this hydrogen peroxide, okay? This hydrogen peroxide can be neutralized via two enzymes. You have catalase as well as glutathione peroxidase, okay? Catalase is not very efficient, so we go to our glutathione peroxidase. So this glutathione peroxidase is the main enzyme that will be used to detoxify the hydrogen peroxide. Glutathione peroxidase will use something called glutathione, a reduced form of glutathione as a cofactor, okay? This reduced form of glutathione, once it is used by the glutathione peroxidase, will be oxidized into the oxidized form, okay? Now that we have the oxidized form, we want to recycle it back into the reduced form so that the glutathione peroxidase can still function, okay? How this is done is via another enzyme, which is your glutathione reductase. This glutathione reductase needs a cofactor, which is your NADPH, and this NADPH comes from your pentose phosphate pathway. Hence, the glutathione reductase will convert the oxidized glutathione back into the reduced form so that the hydrogen peroxide can function normally. And so the hydrogen peroxide glutathione peroxidase can function normally, and so the hydrogen peroxide can be converted back into water, neutralizing the hydrogen peroxide. Okay, is it clear? Okay, let's move on. Uh, okay, so this is basically the recap of the whole slide that everything we just explained. If you guys want to see it later, okay, so any questions so far? Anything you guys want me to repeat? Okay, doesn't seem like it, so let's move on. Now, a question for you guys again. So, a scientist adds excess ferric iron into a cell culture and noticed increased hydroxyl radical formation. What enzyme or molecule is most likely enabled by this increase? Answer in the chat. Okay. Okay. Yes, the answer is B. Okay. So it says enzyme or molecule. So we'll take molecule over here because we look at this Fenton reaction again. Um, so we have So it says that we have increased hydroxyl radical formation. So the main thing that causes the hydroxyl radical formation is when the ferric iron will go and react with the superoxide, okay? This will cause the reduction of the iron into Fe2 plus form, and this Fe2 plus form will go and react with the hydrogen peroxide and lead to the formation of your hydroxyl radical. Clear? Okay, let's move on. So now we'll be talking about the physiological production of reactive oxygen species. So reactive oxygen species and reactive nitrogen species, we think that they're always harmful, but they also have beneficial roles in our body, okay? So let's start with superoxide, okay, in our phagolysosomes. So superoxide will be produced by our neutrophils to kill bacteria. They're needed for your innate immune defense. Your innate immune defense is basically your body's first line of defense. It basically provides your immediate, non-specific protection against pathogens. Then we also have nitric oxide. The nitric oxide is a reactive nitrogen species, that's as we took earlier, but it also functions as a vasodilator and it also helps regulate your blood flow and blood pressure. And it also contributes to your antimicrobial defense. However, again, we took this earlier, reiterating everything. Superoxide and nitric oxide, when they're produced in large amounts, they will come into contact with each other, and this will lead to the formation of peroxynitrite, which is not beneficial and will cause damage, and it is very highly reactive, and it will cause damage to your tissues. Okay. Now, another thing, when the oxygen concentration is high in your red blood cells, the production of reactive oxygen species will be lower. Okay, this seems a little counterintuitive because when you have a lot of oxygen, you think that oh, many more of the oxygen is going to go and become superoxide and random free radicals, but this is not how it happens. Your body has basically has a mechanism to protect itself. So when all the spots on your hemoglobin is occupied by oxygen, this basically protects your RBCs from oxidative stress and from the formation of free radicals. Okay, now moving on to reperfusion injuries. Okay, this is a little important, so I want you guys to focus up with me. So what is a reperfusion injury? So reperfusion injury is basically the tissue damage that happens when your blood supply to a tissue returns, okay? So you have a period of ischemia, which is basically a period of amount of time where you have no oxygen to that tissue. Once blood returns to it, it will cause reperfusion injury. So how this happens, the mechanism for this is that during ischemia, you have low levels of oxygen, right? Because there's low levels of oxygen, ATP levels will then decrease, okay? Because of this decrease in ATP, this will lead to the generation of NADPH, okay? Now, we have a lot of NADH. When blood supply is restored to that tissue, there will be a lot of electron transport chain activity at your complex 1. And this will lead to your electron leakage, okay? This electron leakage will then go react with oxygen. These electrons will go and react with oxygen and other species, resulting in the formation of superoxides, okay? Let's move on. Now we'll be talking about the generation of free radicals under normal conditions. So even under normal conditions, a small portion of oxygen inside your body, around 1 to 4%, will be converted into free radicals. Okay, how this happens is via two main ways. Okay, firstly, you have your electron transport chain leakage from in your mitochondria, and secondly, you have a few enzymes that cause this. Let's start off with electron transport chain. So again, The primary site of free radical production in your cell is your electron transport chain in your mitochondria. During normal oxidative phosphorylation, the electrons will be transferred through your complex 1 and complex 3. This will cause some of your electrons to leak, and they will go and react with oxygen, and this will cause the generation of superoxide. Next, as we said, secondly, we have the enzymatic production of free radicals. So let's start off with xanthine oxidase and aldehyde oxidase. They are involved in nucleic acid and aldehyde metabolism, respectively. They will convert their substrate into products, and while doing so, they will generate superoxide anions and hydrogen peroxide as byproducts. We mentioned this earlier as well regarding xanthine oxidase. Lastly, we have nitric oxide synthase. Okay, so nitric oxide. Okay, so your nitric oxide is generated in your macrophages by the enzyme nitric oxide synthase. How this enzyme works is basically it goes and converts your arginine into nitric oxide. Nitric oxide, again, it's used for antibacterial defense, killing the pathogens and whatnot. And then you also have it also functions as a vasodilator, regulating the blood flow and blood pressure. Okay, so that's all for this slide. Now we will be quickly recapping everything we just took. So, reactive oxygen species and electron transport chain leakage, okay? So we have our mitochondria over here, right? And in our mitochondria, we have the two complexes, complex 1 and complex 3. These are the main sites of reactive oxygen species production. When there is an excess of NADH, the electrons will enter complex 1 in large amounts, and this will cause a lot of electrons to leak. And these leaked electrons will go and react with oxygen, leading to the formation of superoxides, okay? Now that we have superoxide, we want to convert it into something that's less reactive. How this happens is via the superoxide dismutase. The superoxide dismutase will go and convert the superoxide into hydrogen peroxide. Now, what happens to the hydrogen peroxide is two things. The hydrogen peroxide can either be converted into the hydroxyl radical, or it can be neutralized into water and whatnot. So let's start off with the detoxification pathway, producing water. So the cells have the enzymes, two enzymes that we just mentioned, catalase and glutathione peroxidase, which are used to detoxify hydrogen peroxide, as will lead to the generation of water. Next, we have the conversion of hydroxyl radical into the conversion of hydrogen peroxide into the hydroxyl radical. And how this happens is via, again, the Fenton reaction, leading to the formation of hydroxyl radical. This is a recap, so hopefully covered everything again. Let's move on. Now, we'll be talking about the NADPH oxidase in our phagocytes, okay? So your neutrophils and macrophages. So other than your mitochondria, the majority of the reactive oxygen species are produced via the enzymes produced in your phagocytes, okay? How this happens again, your phagocytes, they have the enzyme and NADPH oxidase, which requires NADPH again to function. This enzyme will convert your oxygen into superoxide, and the superoxide again will be converted into hydrogen peroxide via the superoxide dismutase, and then they will form the other products that will lead to the destruction of your pathogens. All right. Any questions so far? Okay. Let's move on. So now we'll be talking about NADPH oxidase and reactive oxygen species in our neutrophils, okay? So in our neutrophils, we have in our neutrophils we have glucose 6-phosphate. This glucose 6-phosphate will enter the pentose phosphate pathway, where we have the key enzyme G6-PDH, glucose 6-phosphate dehydrogenase. This glucose 6-phosphate dehydrogenase basically will generate NADPH. Okay, this NADPH is required by NADPH oxidase to function. The NADPH oxidase converts your oxygen into superoxide. Okay. NADPH by itself is specifically required by two enzymes, as we said earlier, glutathione reductase and NADPH oxidase. Again, this step whole thing, the only new thing over here is the glucose 6-phosphate pathway, where we see how the NADPH is generated, but we already took the two enzymes and how they function earlier, okay? So what happens when your NADPH or your NADPH oxidase is defective, okay? This will lead to a lack of production of NADPH and NADPH, and so the cell will not be able to produce superoxides. Now we know that superoxides are needed for the bacterial killing. Okay, so what happens when the bacteria are not killed? This will lead to a disease condition known as chronic granulomatous disease, okay? Let's talk more about the disease. So we have chronic granulomatous disease, CGD. It is basically a disease that is caused by the genetic deficiency of NADPH oxidase or G6PD-H, okay? Either way, the problem will be the same, regardless of which of the enzymes are missing. The problem is the same. The white blood cells cannot produce superoxide. We already said that superoxide is needed for bacterial killing during the respiratory burst. So when the neutrophils cannot produce superoxide, the patient becomes very susceptible to catalase positive recurrent infections. Okay, catalase positive organism. So in your slides, you had listed Staph aureus, E. coli, all of this stuff, but you don't need to know the names of the bacteria. Just know that they are catalase positive, and people who have CGD are more susceptible to recurrent infections from these pathogens. Okay. Now, how will we diagnose the CGD? What we do is something called a nitrobrew tetrazolium test, NBT test, okay? This basically tests for the NADPH oxidase activity. We use so normally in your neutrophils we have functioning NADPH oxidase, right? And so this will produce your superoxide. The NBT test, it has a dye, the NBT dye, that will turn blue when it comes into contact with the superoxide. But in CGD, this does not happen, okay? Because you don't have the enzyme functioning normally, so there'll be no superoxide production, and so the NBT dye will not turn blue, and this will be a negative NBT test, okay? So, point to note, a positive NBT test does not indicate a deficiency in the two enzymes, while a negative NBT test will indicate a deficiency in the enzyme, and hence leading to the diagnosis of CGD, okay? Now let's move on. Now we'll be looking at reactive oxygen species in our red blood cells and how this will relate to G6PD-H deficiency. So we've already seen this slide. You guys have probably already seen the slide in FND, but we'll be recapping it. So again, we have glucose 6-phosphate. It will enter the pentose phosphate pathway, also known as your HMP shunt. Here, the key enzyme would be your G6PD-H, which is your glucose 6-phosphate dehydrogenase, and it will be used to produce your NADPH, okay? Now, NADPH is very important for your red blood cells specifically because your red blood cells are under constant oxidative stress as they carry oxygen, okay? This oxygen can sometimes spontaneously be converted into hydrogen peroxide. So, what will the red blood cells do once they come into contact, once hydrogen peroxide is produced, okay? The important enzyme over here again is glutathione peroxidase. Okay, now your glutathione, okay, so the important enzyme over here is glutathione peroxidase. Again, the cycle, I'm repeating it again as we just took it. So you have your hydrogen peroxide. This hydrogen peroxide is converted into water via the glutathione peroxidase. The glutathione peroxidase requires the reduced form of glutathione, and this reduced form will be converted into the oxidized form. And this oxidized form will be recycled back into the reduced form via the enzyme glutathione reductase. This glutathione reductase requires NADPH as a cofactor, and this cofactor comes from your pentose phosphate pathway via the enzyme G6PD-H. So now, what will happen when someone has a G6PD-H deficiency, okay? If someone has a G6PD deficiency, they will not be able to produce enough NADPH, okay? Now, once the NADPH is low, the glutathione cannot be regenerated. Once the glutathione cannot be regenerated, the glutathione, the oxidized form of glutathione will start to accumulate, okay? Because the glutathione peroxidase cannot function, and so there'll be a buildup of hydrogen peroxide. So once the hydrogen peroxide starts to build up, two main things will happen, okay? You'll have damage to your cell membrane as well as the accumulation of globin proteins, okay? So let's start off with the globin proteins. So the hydrogen peroxide will go and damage the globin portion of the hemoglobin, okay? What this causes is the globin chains will start to fragment and they'll start to clump together, and this will form Heinz bodies, okay? These aggregates of damaged hemoglobin will be caused by the oxidative injury, okay? Now moving on to, okay, over here you can see you can see the smear, the red blood cell slide smear, okay, and you see these little balls over here. These are basically your Heinz bodies. These are formed once the globin protein chains will start to fragment and clump together, okay. Now, the next thing that happens, the other thing, we'll have membrane damage. So the hydrogen peroxide will go and attack your phospholipid bilayer in your red blood cells, right? And what this will cause is that it will weaken your cell membrane and will lead to hemolysis. The result of this will be hemolytic anemia, And this can be triggered by the other stuff over here mentioned, the things that cause oxidative stress, infections, drugs, and fava beans. All right. Let's move on. Checkpoint real quick. Do you guys have any questions so far? Anything you want me to repeat? Okay, doesn't seem like it. So let's continue. Question for you guys. So a patient experiences myocardial ischemia forming, followed by reperfusion. Which biochemical event is most responsible for the sudden burst of reactive oxygen species? Okay, yes, it is D. Good job. So as we said earlier, reperfusion injury happens when there's a period of ischemia. During this period of ischemia, there will be a lack of oxygen, so there will be a lack of ATP, and this will lead to a buildup of NADPH, and this will once oxygen is reduced, there will be there'll be a lot of activity at your complex 1 and complex 3 in your mitochondria, and this will lead to the generation of superoxides from your oxygen that is produced. All right. Next question. Which enzyme directly requires NADPH to maintain protection against oxidative stress in RBCs? A. Glutathione peroxidase, B. Catalase, C. Glutathione reductase, D. Superoxide dismutase. Yes, it is C. So over here it says which enzyme directly requires. Okay, so if it was indirectly, they could have maybe the answer could have been superoxide. My bad. The answer could have been glutathione peroxidase. So it says directly. So we know that we need NADPH directly by the it is needed directly by the glutathione reductase for the conversion of the reduced form of glutathione into the oxidized form. Hence why the answer for the enzyme that directly requires NADPH is glutathione reductase. All right, let's continue. So now we already mentioned this, but we already mentioned that like the cellular metabolism mechanisms that will lead to the generation of reactive oxygen species. Now we'll be talking about the environmental generation. This like just the slide is just here for the sake of completion. So I'll go through it real quick. So we have radiation. It is a major source of reactive oxygen species. The examples include UV light from like the sun, X-rays that you get in the hospital, gamma rays. What this all basically does is all of these will go and they can go and split the water molecules and cause generation of free radicals. Then we also have the environmental chemicals. There are many of these. We have ozone, which is there in polluted air, singlet oxygen species, superoxide generating compounds. You don't need to know the specifics of all of these, but just know the general idea. Drugs, just keep in mind these two drugs specifically, because your doctor seemed to emphasize on it. So acetaminophen, which is basically your paracetamol, in an overdose, it will be metabolized into into free radicals, and these can go and cause damage to your liver as well as your kidney. And you have your phenols. These phenols are basically they're found in some cosmetic products and can lead to the production of reactive oxygen species. These two specifically, just keep that in mind, and other than that, you should be good. Let's move on. Now, we'll be looking at some of the harmful effects of free radicals. So we know that free radicals can cause damage, right? So they can cause damage to many biomolecules, including your proteins, lipids, carbohydrates, and nucleic acids. So we'll be taking each of these in turn right now. Let's start off with proteins. Okay, so free radicals can oxidize your sulfhydryl groups that are found in your proteins, and this will cause modification of your amino acids within the proteins. What this basically does, it will cause the fragmentation and aggregation of these proteins and cause them to become non-functional. An example of this, something that we just took, is your Heinz bodies found in your G6PD deficiency. Okay. Next, we have our lipids. Okay, lipids, lipid peroxidation basically. So lipids, especially the polyunsaturated fatty acids that are found in your cell membranes, are the major targets for free radicals. Okay, this process is basically a chain reaction. Okay, so when free radicals they will attack these lipids, it will cause lipid peroxidation. So these oxidized lipid peroxides will go and cause more peroxidation of the adjacent lipids. Okay, this will cause damage to the adjacent lipids, producing more free radicals, and these lipid peroxides can go and spread to the damage to other proteins, lipids, and even DNA. Okay, so let's take this in a little more clear way. So as we said, Lipid peroxidation will cause damage. So how does this happen? So you have damage to your cell membranes. So your membranes are made up of your lipids, proteins, and channels. All of these, once they are damaged, they will cause a loss of membrane fluidity. They will cause damage to your membrane proteins and channels. They will cause disruption of your membrane signaling. It will also cause an increase in ion permeability because, as you know, all of these will regulate your ions such as your sodium, potassium, calcium. And when they're damaged, there will be abnormal movement of these ions and hence cause random ion permeability. Next, we have the damage other than the cell membrane. So the lipid peroxides will not stay limited to your cell membranes. What they will also do is they will go and attack, again, your proteins and DNA. Proteins, again, will cause oxidation and modification of your amino acids, leading to the fragmentation, aggregation of proteins, and this causes the proteins to become non-functional. Then you have the DNA. Lipid peroxides will cause DNA strand breaks, and it will also cause mutations. These mutations can lead to the risk of many diseases and even cancer, okay? Let's move on to the other two substances, our carbohydrates and our nucleic acids. Okay, now pay attention for carbohydrates. So we have carbohydrates, right? So glycation is when a sugar molecule will go and bind to a protein. This will cause the formation of a glycated protein, carbohydrate, okay? So the glycated protein, they're basically the weakened and more they're basically very weakened and they're more susceptible to free radical attack. Okay, when these free radicals go and attack the glycated proteins, which is they'll form something called advanced glycation end products. Okay, AGEs. Okay, the clinical relevance for these AGEs is especially found in diabetic complications complications. Okay, so four of these main complications that you guys want to keep in mind. You have neuropathy, which is your nerve damage, nephropathy, which is your kidney damage, retinopathy, damage to your retina, and you have cardiovascular disease due to atherosclerosis and vessel damage, okay? So the summary of this, you have high sugar. These sugars will go and bind to proteins. This will cause the formation of glycated proteins. These glycated proteins will go and will be attacked by free radicals. This will cause the formation of AGEs, and these AGEs will go and cause various clinical symptoms, okay? Now, nucleic acids. So, free radicals, they can go and cause DNA strand breaks and also cause base fragmentation, okay? What this will basically lead to is it'll lead to cell death, okay? It can also lead to the increased risk of mutations and can lead to the development of various diseases and cancer, okay? Now, these are basically the other diseases that were listed in your slides. The doctor himself, he basically skimmed all over them. So I'll go through them real quick, but you guys don't have to keep all of this information in your mind. Just keep the highlighted stuff in mind and you should be good, inshallah. So let's start off with cardiovascular diseases. We have LDL. It is a particle, as you guys know, that carries a large amount of cholesterol. When LDL is oxidized, it is very susceptible to free radical damage. So it'll be oxidized, and this will lead to the formation of oxidized LDL. Oxidized LDL is formed. It will go and stick to your endothelium in your blood vessels. When it accumulates, it will cause even more oxidized LDL to form. Over time, this will build up and lead to the formation of atherosclerotic plaque. This causes the narrowing of your blood vessel lumen and will lead to the generation of cardiovascular diseases. Next, we have cancers. Free radicals can cause damage to your DNA. This will lead to, as we said, strand breaks and base modification. And this type of damage will increase the risk of mutations, cytotoxicity, and lead to cancer eventually. Then we have inflammation. Free radicals can go and damage the extracellular components in your tissues and different organs. What this basically will lead to is glomerulonephritis and ulcerative colitis. Glomerulonephritis is basically the inflammation of your glomeruli in your kidneys. And ulcerative colitis, on the other hand, is basically the inflammation and ulcers in your colon and rectum, okay? Then we have respiratory diseases. They will basically so basically, free radicals will go and damage the endothelial lining of your lungs. This can lead to lung edema and impaired gas exchange. Cigarette smoke is important over here because it can accelerate this process and lead to more respiratory diseases. Then we have diabetes mellitus. Free radicals will go and attack your islets of Langerhans in your pancreas. These are the cells that basically produce your insulin. This will lead to a decrease in insulin production and eventually hyperglycemia, okay? Then we have cataracts. Basically, free radicals will go and damage your lens and will lead to your lens being clouded, and hence you'll have the generation of cataracts. Male infertility. So free radicals can go and damage the sperm cells, reducing their motility and viability. And that's basically it. That's all you guys should keep in mind. And It's a lot of stuff, but your doctor basically skimmed over it, so you should be good, inshallah. Let's move on. Checkpoint real quick. Do you guys have any questions? Anything you guys want me to repeat? Okay. So, question. A lipid-rich membrane undergoes oxidative damage, resulting in a vicious cycle of radical formation. Which molecule is responsible for driving this ongoing chain reaction? Hydrogen peroxide, lipid peroxide, ferric iron, nitric oxide, peroxynitrite. Okay, yes, it is B. So as we said, lipid-rich membranes, so lipid peroxides are the ones that cause oxidative damage. Lipid peroxide will go and have oxidative damage on the adjacent lipids, leading to the formation of more lipid peroxides, and these will basically form a vicious cycle of free radical formation. So it is B. Okay. Now, let's move on to medications, okay? So your doctor basically told you guys, had a whole bunch of stuff in your slides like this, but the main thing you guys want to keep in mind is acetaminophen from all of that stuff. So just know acetaminophen is your paracetamol, and when someone abuses paracetamol, this will lead to a lot of oxidative stress in their body. The degeneration pathway of paracetamol will lead to the generation of a lot of free radicals, and these free radicals can go and damage your liver and kidney, okay? These were the other medications that he listed, but he himself just skimmed over it. So you guys don't need to know this. I doubt he will ask anything. If he asks anything, it will only be about acetaminophen. So we're almost done now. So now we know now we'll be moving on to the balance between the oxidative stress and antioxidative system. So in our body, there's always a balance of stuff, right? Like there's always homeostasis. So the same way, we must have an equilibrium between our oxidative stress and our antioxidative system. We all have already discussed how the reactive oxygen species are generated and how they contribute to various oxidative diseases. So now what we will do is that we will discuss how our body protects itself from from this oxidative stress. So how they do this is via the antioxidative system. A lot of this stuff we've already taken, so we'll go over it real quick. So we have superoxide dismutase, which is needed for the conversion of superoxide into hydrogen peroxide. Then we also have glutathione peroxidase, which will convert your hydrogen peroxide into water. Then we also have our catalase, which will break down the hydrogen peroxide into water and oxygen. We also have our non-enzymatic antioxidants, such as your vitamin E, vitamin C, carotenoids, and flavonoids, which come from your plant sources, basically. And all of these, what they basically will do, they will work together and they will counteract the harmful effects of the reactive oxygen species. So last year, for us, the doctor emphasized on the difference of vitamin E and vitamin C. So he asked us, which of these are toxic? Is it vitamin C or vitamin E that is toxic, and why is it so? Okay, can any one of you guys explain that to me or tell me why? Okay, so put simply, the vitamin C, it is not toxic because vitamin C is water soluble and it will be excreted in urine, okay? This makes it very low risk for toxicity. However, vitamin E, on the other hand, it is fat soluble. And what it does is it will go and start to accumulate in your fatty tissues. And this will lead to a risk of toxicity in high doses. Okay, that's basically it for this slide. Um, Last slide of the lecture. So we'll be moving on to the antioxidant defense that we just discussed. So basically, what is an antioxidant? An antioxidant is a substance that at relatively low concentrations will go and delay or inhibit the oxidation process. What this basically means is that, in simple terms, the antioxidants will go and donate their electrons to a free radical, and they will stop the free radical from stealing electrons. A key point over here that you guys want to remember is that the antioxidants should be effective at very low concentrations. So you don't want to take a large amount of vitamin C or vitamin E for them to act. Even a small amount of vitamin C or vitamin E will go and slow down the oxidative damage, okay? The doctor had this in your slides, but he himself skimmed it. So a lot of stuff we already took, so I'll just go over it real quick. This is the same image from your slides. So we have anti-inflammatory agents. Examples are listed over here. just know that by inhibiting inflammation, they will reduce the production of free radicals. Then you have nitric oxide synthase inhibitors. We know that nitric oxide is important for the antimicrobial defense and vasodilation, so it can go and react with superoxide and form peroxynitrite, which is a very harmful antioxidant. So what we do is we inhibit the enzyme that produces nitric oxide, and hence this is a form of antioxidant defense. Then we have metal chelators. A chelator is basically a substance that will go and bind to metals, and this will go and reduce the reactivity. So, for example, as we said earlier, we have iron, which participates in our Fenton reaction. It'll go and react with hydrogen peroxide to form hydroxyl radicals, right? So when we use a metal chelator, it will bind to iron and prevent this reaction from happening, and hence it will cause a decrease in oxidative damage. Second last, we have NADPH oxidase inhibitors. Basically, your NADPH oxidase, the enzyme that we talked about earlier, it generates superoxide during bacterial killing. So when we inhibit the NADPH oxidase, we'll reduce the production of superoxide, which is, again, a form of antioxidant defense. Lastly, xanthine oxidase inhibitors. We talked about how xanthine oxidase is used in purine degradation, but it will produce superoxide as a byproduct. So when you inhibit this enzyme, this will lead to a reduction of xanthine oxidase activity and hence reduction in the formation of superoxides. And so that's it. Thank you guys so much for attending this pal. I know I talked a lot, but there was not a lot of information on the slides. But once you guys get the slides, there will be notes, and in the notes, everything that I covered and discussed will be present over there. So you can use that, inshallah. Here is a question bank that I made for you guys, inshallah. This is relatively high yield and should help you guys. It has around 30 questions. And here's the feedback form. Since this is my first pal, I'd love you guys to give me your feedback, and that's basically it. Thank you guys so much for attending this pal.